I'd now like to recognize the gentleman from North Carolina, Mr. Butterfield, for 5 minutes of questions.
Thank you very much, Madam Chair, for convening this very important hearing. I think it's important to all of us, and we can tell that by the attendance here today. The members, even though there are 2 or 3 hearings going on at the same time, members are trying their best to go in and out to hear from these witnesses. And so thank you so very much for the hearing, and certainly thank you to the witnesses. You know, I, some years ago, was taught that corporations, I guess I was taught this in law school, corporations exist to create a product and to make a profit. That's 101 in corporate law, to make a good product and to make a profit. And I assume that most, if not all of you, agree with that statement. But in the world of drug manufacturing, how do you reconcile the corporate desire for profit against the fact that you make a drug that can save lives? And I represent a low-income district in eastern North Carolina, and so many of my constituents simply cannot afford drug prices. They cannot afford the out-of-pocket costs, and they cannot afford the other costs associated with health care. And so how do you reconcile, Mr. McCarthy, the appropriate goal of a company to make a profit against the need to create affordable medications?
Well, for us, it's fairly simple. We feel like we will succeed through our innovation. If we are able to develop an innovative medicine and bring it to patients in need, we will do well, the health system will do well, but most importantly, our patients will do well.
What are some of the factors and price points that drug manufacturers consider in establishing prices? Yeah.
So as I mentioned earlier in response to the chairwoman, we always start with what the burden of the disease is, and what are available treatments to that patient, how are they managing that condition, what is the burden to the system, does it result in hospitalization, does it lead to death? That's always our starting point, and then we look at what benefits does our medicine bring, and it has to be either safer, more effective, deliver savings to the system, otherwise we don't pursue it. But those are the main factors, but we also look at the population. Some of the diseases we're looking at now have very, very tiny populations. They're very rare conditions. So we look at that, and we look at affordability, but we also look at our ability to sustain investments in innovation.
So affordability is a consideration.
It is absolutely a consideration.
What about with Amgen? Same thing? Do you consider affordability?
Yes, sir, we do.
That is a factor in drug pricing?
Yes, it is.
All right. All right. Someone mentioned earlier in their testimony that one legislative solution could be capping out-of-pocket costs for Part D. And I certainly agree with that, and I'm trying to think that through. If an out-of-pocket cap is put in place under Part D, what are the corresponding changes on the other side of the ledger? Does the cost for the insurance company go up? I mean, how do you compensate for the cap?
So I'll offer to answer that since I was the one who raised it. I think there could be thoughtful reform to the Part D benefit. And what we would consider, we would like to discuss more, is possibly closing the coverage gap and then shifting the various responsibilities in the catastrophic phase. So the cap would eliminate the 5% patient responsibility in the catastrophic phase, and then there would be shared responsibility between the manufacturers, the plans, and the government. That would be our recommendation.
Thank you for that. Some people suggest that drug manufacturers are tone deaf when it comes to the affordability of drugs, and I think that may have been the case some years ago. But I've discerned a change in attitude among all of you over the last 3 or 4 years, and I want to thank you for it. And I look forward to working with each one of you as we together try to lower drug costs in this country. Thank you so very much for coming. I yield back.
I thank the gentleman yields back and thank him for his excellent questions. I now would like to recognize